Genetics and Substance Use Disorder by Chioma Odili, RN, BSN. Substance use disorder is a condition that consists of substance abuse and dependence. This causes a decrease in functionality in work, school, and family obligations. Such substances include alcohol, stimulants, sedative hypnotics, opiates, cannabis, and other prescribed or street drugs. Substance Abuse and Medical Health Service Administration reported 22.1 million persons were classified with substance dependence or abuse in the past year. They also reported 23.1 million persons aged 12 or older needed treatment for an illicit drug or alcohol use problem in 2010. The total cost for the average length of stay in an inpatient psychiatric hospital is $5,500 per person. So what really is the problem? Are environmental influences the cause of such high prevalence of substance abuse? Well, several recent studies suggest genetic factors grossly affect individual risks in developing substance-related problems. In fact, Wong, Mills, and Fernandez reported heritability of substance use disorders ranges from 30 to 70%. The purpose of this project is to identify current research findings on genetic influences on substance use disorder, to identify implications of genetics as a risk factor for specific substances vulnerabilities, to report evidence-based knowledge of genetic vulnerabilities to each specific substance by developing a table identifying and depicting the genes involved for each substance of dependence. Lastly, the findings will be presented to psychiatric mental health care providers at Harris County Psychiatric Center in Houston, Texas. Their project objectives are to conduct a literature search on the relationship between genetic markers and substance abuse within 4 months, to develop a table identifying and depicting genes involved with each substance of dependence, then present the finding in the form of an educational event to the psychiatric mental health care providers. Lastly, a pre- and post-presentation survey will be administered to the psychiatric mental health care providers to complete. So what are the incentives? Some of the incentives are that this project will increase the knowledge base of the psychiatric mental health care provider. It identifies the specific gene markers for substance abuse. And lastly, it will aid in providing individualized care. An internal environmental scan reveals strengths and weaknesses, and external environmental scan exposes threats and opportunities. A strength is that the foundation of this project is evidence-based. Also, it involves already published research literature that identifies the current findings of the genetic vulnerabilities. Lastly, it may be used as a stepping stool for updating clinical practice guidelines. Some weaknesses include that there's a lack of time, or that this project is very time-consuming, and that this project may not be adopted by the psychiatric mental health care providers. Within the external environmental scan, the opportunities are that there are 22.1 million persons classified with substance dependence or abuse, and there is a moderate to high heritability rate of substance use disorder. Some threats include the project generates no revenue and has a high budget, and that the project may not be approved by the administrators at Harris County Psychiatric Center. Who are the stakeholders? Stakeholders for this project include psychiatric mental health care providers, patients, administrative staff at the Harris County Psychiatric Center, and people who live in their community. The administrative staff and psychiatric mental health care providers are the early adopters. Let's take a look at the budget. The total funds requested is $8,287.29. $10,624 for personnel costs, $849.92 is for fringe benefits. Travel cost is $99. Equipment, $540. Supplies costs $118.46. $800 for in-kind contribution, and the total direct cost is $13,031.38. For the human subject approval, this project will require a claim for exemption by the committee. In conclusion, substance abuse is a problem that affects millions of people in the society and directly affects the healthcare costs. Adoption of this project will potentially reduce healthcare costs by decreasing the admission rate into inpatient psychiatric hospitals. It will provide research findings on the relationship between genetic markers and substance abuse. And lastly, it will support psychiatric mental health providers in providing individualized care. Thank you.